It could be if somebody doesn't typically do much for activity or exercise. Say they have a desk job, for example. So say that you pulled your shoulder over the weekend. You were lifting something heavy, your shoulder really bothers you. The weekend warrior syndrome is where we see a lot of people. You don't need a referral in order to be seen for physical therapy. You can just call up and say, hey, I hurt my shoulder over the weekend. Can I get in for an appointment? My name is Michelle Alberghini, and I'm a physical therapist. I work at Central Vermont Medical Center, and I am working in one of our 7 satellite clinics that we have. We have a pool facility. We have a clinic in Northfield, Waterbury, Montpelier, Barre, and Berlin. At our clinic on the Barre-Montpelier Road in Berlin, we have an express clinic where we can see acute injuries within 48 hours. So the types of injuries that would be appropriate to come to the express clinic would be anybody that has vertigo, any acute injury. So if somebody has a neck sprain or an ankle sprain, a hamstring strain, a knee strain, anything like that, then they could get in here in a couple of days. And the big focus is if somebody has swelling, you really want to control that swelling really quickly because you'll heal so much faster. So there's some special taping that we can do and some special compression wrapping that we can do that will really get people better faster. If your insurance doesn't require a referral, then you don't even need to see your primary care physician. You can just walk in the door and do a drop-in appointment or call and get an appointment. But you could also, if you went to see, like say you were in a car accident and you saw your primary care physician and they said, yeah, you need physical therapy, because that's an acute injury that does better if you're seen quicker, we would just make sure that you get in a day or two, rather than waiting 10 days or 2 weeks and then having it take that much longer to get better. And with whiplash in particular, we can really help get the muscles relaxed in the neck so that they can turn their head, sleep, and do other things they need to comfortably. You know, sometimes there are people that are training for a particular race, and in the middle of training, they end up with a knee strain, and it's very important to them that they get back into their training so they can be ready for their race on time. So getting here quickly will help facilitate getting them back into their program. And they might need orthotics, or they might need some taping, or just some retraining of certain muscles, or teaching them how to run properly, which we can do on a treadmill with a video camera. It's pretty useful for the patient. The vertigo is when you actually have true vertigo, the room spins. That's the true definition of vertigo. And sometimes what happens is in your inner ear you have these, we'll call them crystals, and those crystals can move for various reasons. And when one of those becomes dislodged, then you don't know where you are in space when you move your head a certain way. So you move and these little crystals float around until they settle down. So you spin for about 30 seconds. And so what we need to do when you come in for physical therapy is figure out where that crystal is and then put it back where it belongs. That way you're not spinning anymore. And so that's just a matter of having you lie on a table and then turning your head and your body in a certain sequence that will put everything back where it belongs. We have a very knowledgeable staff. We support sending our staff to continuing education every year. So we recently sent 8 people to a vertigo training so that we could have somebody at each of our clinics trained in treating vertigo, because it's very prevalent. We have a very specialized staff. I'm very proud of our very specialized staff.